Ladies and gentlemen, my fellow speakers and participants, welcome. Welcome to the RAC Hospital Arise UNDRR webinar series for long COVID. This is our third seminar. Now, our third series today will deal with the, you can see it on the screen, post-COVID digestive disorders and remedies. About 30% of long COVID individuals will suffer from digestive ailments. And so we thought it appropriate that we should have our third webinar on post-COVID disorders and remedies. And we have two outstanding speakers. One is a gastroenterologist, and the second is a nutritionist, and a dietitian. Allow me to introduce our first speaker. Excellent. Ladies and gentlemen, I present to you Dr. Saeed Naveed Azam, the consultant gastroenterologist in the RAC Hospital. And we are indeed privileged to have him, not only in the RAC Hospital, but also on our webinar today. Dr. Naveed is a fellow of the Royal College of Physicians, Edinburgh, and is a certified trainer from the United Kingdoms in gastroenterology. He graduated from the Bangalore Medical College and then went on to do his higher medical training in internal medicine and gastroenterology in both Manchester and in Leicester in the United Kingdom. And he has a fellowship in advanced GI endoscopy. And we are now privileged to have him here with us in the UAE. His special interests include irritable bowel disease and therapeutic endoscopy. But I will not say more. I will leave you in the capable hands of Dr. Saeed Naveed Azam. Dr. Azam, it's all with you now.
So today, we will be talking in brief about digestive problems that we can get in COVID disease and in post-COVID syndrome. I will keep my talk brief so we have enough time for question and answers at the end. Okay, so what is COVID? I'll just take a minute or two to tell you what the COVID pandemic is all about. Coronavirus is a type of virus. There are many different kinds, some of which cause diseases. Okay, so there is a particular type of coronavirus called SARS-CoV-2 that was identified in December 2019, initially in China, and has caused a worldwide pandemic since then. In fact, on 11th of March last year, the WHO declared it a pandemic. I know we are talking to people who have had this COVID or know somebody who's near and dear to them who has had COVID and unfortunately have recovered. But just to recap the natural history of the disease, it's important to remember that for most people, the disease is mild or asymptomatic. For some people, only supportive treatment at home is sufficient. But there are a significant number of people who have severe symptoms and have required hospitalization, continue to require hospitalization. And in different parts of the world, unfortunately, we are seeing 1 to 3% mortality due to the illness. But for patients who have a milder or moderate disease, the illness is fortunately brief and the recovery is reasonably quick. However, we are also seeing what is called long COVID now, which means that the problem is persisting several weeks after the initial infection. The symptoms are persisting, even though the virus itself may not be detected on PCR testing and the patients have recovered from the initial infection, the symptoms continue to bother. Okay, so what's happening? So if you go back to October last year, there was a report and many press releases where this was being reported in the BBC. Then there was also a news on the Times Now saying about 30% of people are having digestive problems, although their respiratory symptoms, their breathing problems, their coughing, the fever has settled, they are getting abdominal symptoms and diarrhea. And this was reported in almost 30% of the people. Then, okay. So it became important for gastroenterologists and other physicians to know what is actually causing these gastrointestinal symptoms and what do we do to help the patients recover quicker. So there were press releases, there were reports like this one here in the Indian Express, where a gastroenterologist from New Delhi was talking about what patients can do. So it's important that people who understand the problem are available to explain this to everybody else. As we can see in this slide, long COVID symptoms could be many different ones. Okay, the main problems, the first problem that is very common is fatigue, and along with that, there could be problems of breathing difficulties with chest pain or tightness. And we also heard about problems with memory and concentration previously, difficulty in sleeping, palpitations, dizziness, pins and needles, joint pains. And there has been a lot of anxiety and depression associated with COVID disease, which is understandable, but we need to find ways and means to overcome this. So if you actually go down the list, then you see the GI systems, which is the digestive system symptoms, which is feeling sick or having diarrhea, stomach pains, and of course, everybody knows now that the change in smell, in the sense of smell and taste, is been a problem right from the beginning. And if it continues, it has caused nutritional problems because people are not able to consume their food as well as they would like to. Okay, this is a range of different symptoms. So I think because we're going to focus on digestive problems, let's just look at this and look at a little bit more basic structure of the GI system. When we talk about the digestive system, we're talking about the gastrointestinal tract, which is the esophagus, the food pipe, which goes on to the stomach, and then the stomach is connected to the small intestine where the food is digested and absorbed, and then the large intestine where the waste is processed and pushed along outside. So this is the digestive system. And of course, there is the liver, gallbladder, and pancreas associated with this. SARS virus, the SARS-CoV virus, the COVID virus, when it enters the body into the respiratory cells, it also enters the intestinal cells, and it uses the same mode of entry as it does in the lungs. So there's a protein called the ACE2 protein, which helps the virus to enter the intestinal cells. Once it's inside, the virus uses the cell's machinery to reproduce. The virus reproduces within the intestinal cells, and this is done by a mechanism of RNA multiplication. When the virus particles leave an infected cell, when they get out, it triggers an inflammatory process. It releases some the cell releases some chemicals, and that triggers off an inflammation. And this is what happens in the lungs, and this is exactly what happens in the gastrointestinal system or the intestines. So what does it do? It damages the lining of the stomach and intestines on the inside, and it disrupts its working, and it causes pain, nausea, and diarrhea. Uh, So when there is inflammation and disruption in the intestinal cells, whatever food we eat needs an intact intestinal system to process it and absorb it. So when there is disruption and damage, the nutrients are not absorbed properly, the salt and fluids are also not absorbed properly, and this causes diarrhea. In fact, if it gets more severe, it can actually cause bleeding because of severe inflammation, erosions, or even what we call ulceration, when there is scratches and ulcers in the stomach and intestines. In addition to this, our intestines have a huge number, billions of bacteria, which we commonly refer to as good bacteria, that help maintain a good, healthy environment in the stomach and intestines. And this is disturbed because of the disruption caused by the virus. In fact, there are reports now saying that the virus is shed in the stools, or it can be found in the stools for many months after the infection is cleared up from the lungs and from the throat and the nose. Uh, and this is raising concerns of whether the virus can actually be transmitted by from fecal-oral route, by which we mean from touching and contamination of hands and utensils, and then if it goes to the nose or to the mouth. So this is where the concept of hand hygiene is so important. In fact, in a small minority of patients initially in China and some places of Europe, the initial symptoms for COVID were actually digestive related, which is nausea and diarrhea, without any respiratory symptoms. So looking specifically at the symptoms of digestive disorders, we all know that any viral illness can make you feel sick and you lose your appetite, you don't feel like eating food for a few days. And in most illnesses, after 2 or 3 days, it comes back. But in COVID, or particularly long COVID, this has been a little bit protracted for some people. And this is compounded by the fact that there's a loss of taste and loss of smell, and the food doesn't taste nice, so you don't want to eat even though you need to. And this has led to weight loss, and if there is, and for some people, there is this problem of increased acidity because they're not eating properly, they're not eating on time, and there are reports of both diarrhea and constipation in people who have had long COVID. Okay, so these are symptoms that are caused by COVID itself, or after the recovery of COVID. But there are people who actually have digestive problems beforehand. So what happens to this? In fact, we have seen a lot of digestive problems that were there initially getting flared up because of this problem. So people who have had excess acidity, digestive problems, IBS, IBD, and unfortunately, there are also people who have had stomach or intestinal cancers, liver disease, and their treatment has been disrupted, and that has led to other problems. So, but that's fortunately few and far between, and most people have had common problems. Okay. So I think we've talked about this, but just to recap, coronavirus can cause symptoms that last for weeks or months, and this is called long COVID, even after the infection has gone. Most people will fully recover, but it may take a few weeks. So if you look at what happens to people 5 weeks after an infection, this was a survey done by the Office of National Statistics in the UK over a long period of 10 months, no, a period of almost 11 months, where they looked at symptoms prevailing 5 weeks after recovery. And you can see that the bottom three are talking about digestive problems, which is nausea, vomiting, diarrhea, abdominal pain. And fortunately, in this survey, it was very less, but clinically, we are seeing a lot more people reporting digestive problems. But you can see fatigue is at the top of the list there. This is 5 weeks after the recovery. And if you look at the age-wise spread of people who are reporting symptoms 5 weeks after the initial infection, you can see that the peak is around between 35 to 70 years. So in the middle ages to the older age groups, the problem seems to persist a little longer. whereas in children, in adolescents, and young adults, it's a little less. So I will talk about three common problems that have troubled people in general, and in particular, people who have had COVID. Okay, because remember, the COVID is a temporary infection, and in people who recover, most of them will have symptoms of acidity and gastritis and irritable bowel syndrome. And of course, we are also seeing people who have had liver problems because of COVID. Okay, so the commonest one is IBS. IBS is irritable bowel syndrome. This is not a disease that we should worry about. This is more of a nuisance than anything nasty. So, what is it? IBS is by definition abdominal pain or discomfort, which lasts for at least 3 days in a month, but usually it's more common than that, and it lasts for several days in a month. And if it lasts for 3 months, we label this as IBS. So it improves once the person goes past the stools, and there's a change or form in frequency or form of stool. This is irritable bowel syndrome. Now we will skip through this, and you can see that IBS affects the same age group of people who have had long COVID, and it's more common in males. And symptoms vary from abdominal pain, incomplete stool evacuation, fullness, constipation, pain, diarrhea, straining, and also milk intolerance when the symptoms are flaring up. GERD is commonly called as gastroesophageal reflux disease. This is where there is excess acidity and acid reflux occurs. And I would say that most people who have GERD also have an element of gastritis. This is a data from Indian subcontinent where uh, this is a very common problem. But if you actually see Indian settled in overseas countries, in Europe, in America, in the Middle East, the problem surprisingly seems to be more common than the other populations. So what do we get? We get heartburn, chest pain, swallowing difficulties, sometimes irritating cough, wheeze, hoarse voice, and the problem becomes more severe. People cannot eat properly, and that leads to weight loss. If consume spicy food, fried food, more non-vegetarian food, aerated drinks, excess tea and coffee, the problem seems to get exacerbated. So we won't talk about the investigations we do. In terms of liver disease, okay, uh, just to make a few points about liver disease in COVID, we are seeing a lot of liver inflammation in patients who are hospitalized with COVID infections. Again, when the acute infection is over, this inflammation will settle down, although it might take several weeks to months. If it is not settled by 3 months after the initial infection, we may need to evaluate the liver for other problems. But by and large, in 90% of the cases, this is seen to settle down in 2 or 3 months. So what can we do? The first thing to do is what we're doing today, is to try and understand the problem. Understanding the problem is half the battle won. When you see your doctor and your dietitian, you will of course get advice as to what to do and how to do and what medicines to take and what foods to take and what foods to avoid during the recovery phase. My one point, if not anything more, is to encourage people to take the medicines, uh, because this will help the recovery much better and much quicker. Follow the advice regarding diet and day-to-day activities, and don't forget. I think people, particularly in this part of the world, sometimes feel very lonely, and there's not much support from friends and family or even colleagues at the workplace. And I think it is important for everybody to reach out to each other and provide some psychological support at home, at the workplace, actual food and nutrition. But I think I just put up a slide here to say that eating well for a good recovery is very important. Okay? Your body needs energy, proteins, vitamins, minerals, everything to help recovery. And there's a good amount of protein and energy-rich foods which helps build the immune system. It helps recover the weight loss by building up the muscles and get your energy levels back to usual activities. And don't forget to keep well hydrated by drinking plenty of fluids. And this is another important thing that we should do wherever we are, to keep taking plenty of fluids. And you can actually take snacks in between till your appetite picks up. Okay, so I think Ms. Ruba will talk about this, so I won't dwell on this too much. So I'll come to the conclusion to say here that, most people will not have a serious illness. This is very important to remember. But treatment should include interventions to manage the symptoms, of course, and help with the quick recovery. And it's very important to focus on improving the quality of life and a sense of well-being and getting back to work and productivity as soon as possible. Addressing your concerns, addressing the patient's concerns, and making you understand what this is and that this is not something we should worry too much about, and learning self-help techniques, I think gives much better outcomes.
A great pleasure to be able to learn something new. I was absolutely fascinated by the way you connected. I noticed that Ruba is also a health coach, which would then mean that not only does Ruba understand the nutritional component of illness, but she also understands these several other aspects of activity and so on. She specializes in therapeutic diets and the management of patients in IP and OP with cardiovascular diseases, hyperlipidemia, digestive disorders, and so important, post-surgery diets. Of most specific help to each of us is and will be Dr. Ruba's advice, Ms. Ruba's advice on weight management and endocrine disorders such as diabetes, etc. She talks about not only therapeutic diet, but also healthy diets across the entire range of human existence. So she's able to manage the diet required for a neonatal, the child, which is pediatric, adult, and individuals like me who are geriatric. So it's a delight to be able to have this knowledge. And also, of course, our own lactating and pregnant clients will greatly benefit from Ruba's advice. Now, Ruba is eminently associated. She's a membership, her membership with professional institutions include the American Academy of Nutrition, and that's only one. And then you have the Arab Nutrition Association, the UAE Nutrition Association, and also the Emirates Medical Association. Now, we in the UAE are currently going through our own Ramadan. So I would be grateful if at the end of her discussion on COVID-related support, if she could just give us a few words of advice on how to manage diet during Ramadan. And I'll hand over to you, ma'am. The floor is yours.
Thanks a lot, doctor, for this great introduction. Let me just share my slides. So basically, as Dr. Naveed said, one of the most things that post-COVID patients are suffering from a lot of symptoms rather than disorders only. So this is the role of nutrition, and where it comes to help these patients to outcome all of these symptoms. And currently, COVID is leading challenge across the globe, as we know, and it is mandatory to attain and maintain good nutritional status to fight against the virus. Nutritional status of individual is affected by several factors, such as age, gender, health status, lifestyle, and medications as well. And nutritional status of individuals has been used as a reliance towards the destabilization during the COVID-19 pandemic. Optimal nutrition and dietary nutrients intake impact the immune system as it is. And therefore, the only sustainable way to survive in the current context is to strengthen the immune system, specifically with healthy diet and healthy lifestyle. And digestive issues have been seen commonly in patients who have recovered from COVID-19, which need to be addressed on time to avoid further complications. Many people who recovered from COVID-19 are still worried about the long-term implications of this disease. However, it's not surprising as many as long-term as such patients have been facing multiple health problems, including GPS syndromes, pneumonia, lung fibrosis, heart or kidney problems, and then also blood vessels problems and even weakness. But there is no other problems that they are experiencing. Another one is very important is the gastrointestinal problems or disorders. Although patients with COVID mainly present with pneumonia, they also may have various digestive system. The management resolving around the symptomatic and protective treatments recommended for these patients. And specifically, these issues need to be addressed on time to avoid any complications, as I mentioned, and they should be avoiding any kind of spicy, oily, and processed food that are actually triggering these symptoms. And as Dr. Naveed said, never ever leave the medications. It's very important to taking these medications on time as well. I'll be addressing most of the common symptoms. I'll be discussing it from different aspects or different GI disorders. And mainly we have seen this among the patients during the COVID and after the recovery. Most of them, they are complaining of the loss of appetite, the smell, or even increased appetite. They have some of the gastritis problems, acidity, and mostly diarrhea and vomiting, and some of the cases anorexia. How to manage these kind of symptoms and how to deal with. Basically, the most common symptom, as in like losing the appetite, it's found that it is really helpful for these patients to split their meals during the day to 6 or more small quantities, but very high dense in calories and in protein. Not eating, not leaving themselves a long time without food, and then not limiting the food that they eat. Just determine what are the times that they are hungry and eat upon, and make it as nutrient dense as possible. And those who are suffering from the pain, usually it is advisable for them to follow a certain diet that will relieve the pain, that actually will be including lean protein. It could be also having healthier cold pressed oils, getting plenty of fiber from different non-starchy vegetables or fruits, getting essential fats from the seeds as well. And not to forget to mention that they should hydrate themselves more often, not only through the water. They can also include certain fruits or vegetables that are rich in water as well. But keep in mind that they should be avoiding caffeinated beverages or the food that are containing gas that may influence their gas in the body. One of the major things that they are suffering from, and it's more common among all of the GI disorders, the acidity. Maybe because they are with a less appetite, they might not eat regularly, and this can trigger this problem more often. So they can just keep drinking water throughout the day. Like each hour, they can just have 1 cup or 1 glass of water, and it is preferable to be at room temperature. To reduce intake of processed food or unhealthy food, again, staying away from alcohol and caffeine, and consume meals on regular intervals, and of course to include more of the fresh fruits they can start with the salads specifically before the meals. It can somehow train or like introduce the food that is coming to the body, and it will relieve the bloatiness afterwards. The fruits can be consumed regularly, that's not an issue, but those who are suffering from the acidity, they should be avoid acidic forming or citrus fruits, let's say. The foods they should not go to bed as well with full stomach. At least leave some time for the body to digest. To include physical activity and meditation on a daily basis. This also acts really well with the acidity problem, and make sure that the medication are taken regularly. Nausea and vomiting are often mild and transit, and COVID-19 has been associated with diarrhea generally, that the mild and moderate, and it's only persistent for only short time. So during that, they should make sure that they are hydrating themselves more often. And then there is no specific therapy for diarrhea caused by, but in general, caused by the SARS, but in general, staying away from food, laxative food is beneficial, and hydrating the body as well. We have also encountered some of the patients are really suffering from anorexia, which is a type of disorder that they actually, or a condition that is of self-imposed starvation. So a lot of nutritional and physiological complications are similar to those of malnutrition as well. And for those people, we advise him to keep eating or keep snacking throughout the day. And even if they are not feeling hungry, they can include the food that are really rich in protein and healthy fats. Of course, adding complex carbohydrates like whole grain products. And they should be also recognizing the feeling of fullness. They will be able to differentiate between that afterwards. And gradually, they can gradually increase their portion sizes. They can start with small portions and increase it therefore. And then add up different variety food groups rather than just focusing on one simple or one type of food. Let them ask them to fulfill their body with the nutrient-dense food. Again, hydrate themselves, and also when they tend to eat, let them like separate the meal or the food from drinking time, because it somehow gives them a feel of fullness. And these kind of people also, they should be supplemented, mostly prescribed by the physician. Or we can also offer them a nutrient supplement like meal replacements if they are not able to consume the food, or if they not feel or willing to. Precautions that they should be taking, it's very important to replenish the body after the illness. They should be focusing on food that are boosting the immunity, staying balanced with the balanced range. To eat on each meal should be composed of proteins, fats, and healthier options of fat, and then fruits and vegetables. B12 and folic acid or iron-rich food, rich vegetables are advisable to be there added, and foods that are causing or initiating the acidity, it should be somehow avoided, and let them focus on including some healthy sources or natural sources of probiotics. If it's not from the medication, they can get it from like yogurts or pickles and a lot of many other sources. Most of the people or majority of these patients, they tend to over drink from herbal teas, assuming that it is beneficial. It's actually good and it's hydrating, but over consumption will actually be as a toxic to the body. It may also act as a laxative. and consuming more than the recommended intake of anything is not beneficial for the body. Chewing and eating the food is very important, as it will lower the tendency of entering the gas or causing gas, entering air and causing gas in the body. Exercise and meditation and having plenty of sleep time is also relaxing the digestive tract. So make sure that to make sure that these patients are having or consuming enough of sleep hours. These are my references. And according to Ramadan, let me just share some of the tips for the fasting, as now we are dealing with a really bad weather, like it's like really hot, and what we are facing mostly during these times is just patients who are coming to us dehydrated. So I highly recommend that those who are fasting, they start hydrating themselves starting from iftar until the suhoor time, maybe like 1 glass at each hour, and then including other sources that can hydrate the body, like soups, starting up with soups and fruits that are, or vegetables that are rich in water, like salads, dates, rutab, or we call it rutab, that is really less in sugar and higher in fiber and water content. They should not also overeat or consume more portion sizes that they actually can. Slowly they can start with their meal, and then they can get like some time for prayers and then get back to complete their meals, which is really helpful to outcome any digestive problems and the burden on the stomach as well. Being active during Ramadan is very important. It will help release as well such problems. It will help maintain the body weight, and again emphasizing on the food group or variety of food that they should be including. Splitting the meals is helpful, so not burdening the stomach with a lot of food all at once. They can just split it into 2-3 meals, and postpone the food at the suhoor time as much as possible, so it will enrich their body with energy and for longer time. Thank you.
Good. But I must tell you that I did listen to every word that Ruba mentioned, and I found it extremely informative, extremely informative. The usual advice of avoiding fatty fried foods, avoiding alcohol and replace it by water, I thought was excellent. Frequent meals, lot of greens. And as I was quite confident that Ruba would say, physical activity and meditation, a completely new perspective to the nutritional component. But well done, I'm delighted that it was there. Probiotics, hydration, a balanced diet with a little bit of extra protein, supplements advised by the doctor, and then advice given for Ramadan, hydration, fruits, and so on and so forth. As I'd expected, an excellent and informative talk. Thank you so much, Ruba. Thank you so much. Friends, we now have our question and answer session. And even while Dr. Wilku may or may not be giving the answers, I must tell you that he is an extremely esteemed individual. It is his moving spirit with which we continue these webinars. Dr. Wilku, besides being a physician, is a member of the American Council of Lifestyle Medicine and the American Council of Preventive Management. He has, in his space of 20 or 30 years, benefited more than 12,000 children, 60,000 employees, since corporate health is one of his specializations, and he is an avid teacher. He has more than 2,600 talks and is a faculty of the AHERF, that is the Apollo Hospitals Education Research Foundation, and our very own RAC MHSU. Dr. Wilku, if you can manage the question answer session, I'd be so grateful.
Yes, sir. Thank you so much, Professor Kennedy. And first of all, thank you, Dr. Naveed and Ms. Ruba for a fantastic presentation and giving very important information. There are few questions which I would like to start. I think this answer can be given by both Dr. Naveed as well as Ruba in their respective fields. One participant, Mr. Vetri Chelvan Francis, has asked, he feels so much of gassiness and every time he feels bloated. What is the reason and how to take care of it?
Yes.
Yeah.
Do you want me to go first?
Okay.
I'll read out the question, sir. I will read out the question. Mr. Francis, Vetri Chelvan Francis, he has asked that he feels more gassiness and every time he feels bloated. And what should be done?
Okay, right. So look, this is a very common problem, okay? About 60, 70, maybe 80% of patients that are seen in my clinic. Okay, so this is a very common problem. And the challenge is to find out if there's any stomach-related disease or intestine-related disease that is causing these symptoms, or is this a disturbance because of the type of food we eat? It's very difficult to answer this question in an individual case, so I won't be without doing proper analysis. So as a general rule, I would say that there are two categories here. A, there is a disease process that is going on in the stomach, intestines, liver that is causing the symptoms, or everything is fine, but there is disturbance because of what we consume or our lifestyle habits, smoking, too much alcohol, not having proper toilet habits. I mean, simple things like that can make a problem feel much bigger over a period of time. Okay, and of course, choosing the wrong kinds of foods to eat, eating at irregular times, or even staying hungry for long periods of time, not consuming enough fluids, not having enough fiber in the food. These are all factors. So when you see a doctor, the doctor will basically ask you a few questions and try and figure out, okay, is this individual suffering from a lifestyle problem or is this a disease process that is going on? And if the concern is that there might be a disease process, we have to do some tests to find out what's going on. Is there an infection there? Is there stomach damage because of acidity or infections? Or is there inflammatory bowel disease? Is there a liver disorder? Bloating is a very common non-specific symptom. Okay, it basically tells me that there is some digestive process that is misfiring or malfunctioning. Okay, and we have to talk to that individual and try and go down a algorithm to find out, okay, what is done and what sort of treatment we do. In young people, I would say that most of the time it's a disturbance, a functional problem rather than a disease process. So we would try to give them some medicines, some dietary advice, some lifestyle advice to see whether things get better with simple measures. And in about 4 weeks, 6 weeks, things are not better, then we would probably do more detailed evaluation.
Okay. Ms. Ruba, you can also put your guidance.
I can add also some of the things like certain eating habits. It can also influence the gas or bloatness, like eating very fast or chewing like very fast. Maybe also drinking while eating as well. These are all factors that may influence the bloatness that he's having, along with any other, of course, problem if he has already any digestive problem or any disease related. So things that he needs to do to lessen the problem is to eat healthy in a healthier way, staying away from gas-forming food, spicy food, as I said again, and even caffeinated beverages should be limited, focusing more on the food that can or it's more or easier to digest.
Yeah, thank you. One question, I think the person is asking for somebody else. Mr. Sam Kadam, he's asking what implications COVID-19 has for someone who is suffering from ulcerative colitis or Crohn's disease. I think he's asking for somebody else.
Okay.
Yeah.
I'll be happy to answer that question. Look, if somebody has Crohn's disease or ulcerative colitis, these are the category of diseases that fall under inflammatory bowel disease. This is a long-term condition that requires long-term treatment. That's the main thing to remember. Of course, there's good treatment and it can be treated properly and controlled properly. So if an individual has Crohn's or colitis and has any other illness, whether it be COVID or any other viral illness, it does lead to some certain challenges, okay? Because you have to treat two problems at a time. And people who are suffering with colitis or Crohn's disease are usually taking immunosuppressant medicines or steroids that reduces their immunity. And that adds an extra dimension of challenge to people with, say, for example, COVID illness. We were worried at the beginning that, people who are on these steroid medicines or immunosuppressant medicines or biological agents that they're taking intravenously or as in injectable forms, whether the COVID problem will be a more severe form of that.
Yeah.
There has been a little bit more severe disease in people on immunosuppressants, but fortunately, most people have recovered like everybody else. To think why the Crohn's or colitis itself will become more severe in this situation. Yes, you will have a little bit more diarrhea, that is because of the COVID, but doesn't mean that the Crohn's and colitis is actually getting worse because of that. The only good thing that we can see in this situation is that for most people, because COVID is a time limited condition, most people are better in 2 to 3 weeks. Following that, the Crohn's and colitis also gets back on track to how it was before the infection, and we can just continue the treatment. If people are hospitalized or if people are having symptoms, we have stopped steroids, we have stopped the immunosuppressant medicines at that time to help recover from the viral infection quickly and then continue it later. So yes, it does add, because you're dealing with two problems at the same time. So we have to tailor make the treatment to the individual, but I completely agree that it has come with its own challenges. And in fact, there is also a little bit of confusion about vaccination. People are taking medicines for IBD or any other condition that requires immunity suppressant medicines. Should we vaccinate them? Should we not vaccinate them? And there is now consensus building up that yes, it is probably on balance better to vaccinate them because the risks of side effects is not any greater. The only concern is that because immunity is already low, the vaccine might not give you the same efficacy as somebody else, but it is still better than not taking a vaccine.
Yeah. Yes, sir, thank you. Sir, there is one more question. Again, I think he's asking for somebody else who was suffering. People feel nauseatic and feel dull pain in the pit after eating. I think he means with the pit of stomach.
You want me to answer?
Yeah, I think you should be answering, sir.
Yeah, again, nausea is a very non-specific symptom. I mean, it's associated with bloating and discomfort. But if there is pain in the stomach after eating, then that usually suggests that there is some inflammation. It could just simply be gastritis. But sometimes you have to think about whether there's a risk for any stomach ulcers, that are because that's causing pain after eating. Sometimes gallstones or even pancreatitis problems can also cause pain when you eat food, and this will need to be ascertained in a clinic by the doctor talking to you, asking a few questions, and more importantly, putting the hand on the tummy and actually seeing if there's anything to worry about, and then perhaps getting an ultrasound scan or a simple X-ray to see what the problem is. But nausea itself is not something that I would be worried about, but if there is persistent pain, I would get it checked over and get it evaluated.
Yeah. Correct, sir. Thank you. Sir, Mr. Sahed Singh is asking, because he has sent a mail also. Now he's asking, is COVID-19 increasing the complications of appendicitis? Because the mail he sent, he said he had a pain, and when he consulted the physician has said he is suffering from appendicitis. So now he is asking the same question in that does COVID-19 increase the complication of acute appendicitis?
Appendicitis is a very specific problem. Okay, it is a very localized problem. It's a problem where the appendix, which is a tiny structure in the intestines, gets inflamed because of infection or because of impaction or because of a stone or something like that. It can happen to anybody. It can happen at any time, but it's more common in youngsters, in children. But of course, anybody at any age can get appendicitis. Whether it'll be very unfortunate if somebody has acute appendicitis and COVID infection at the same time, because these are very acute conditions.
Right.
Just a sheer bad luck to have two things at the same time. But having COVID itself does not increase the risk of getting appendicitis. COVID doesn't cause a specific inflammation in a specific organ. It generally causes generalized inflammation. So there is chemicals in the body called cytokines, which cause inflammation. And it can cause inflammation in the lungs, in the liver, in the stomach, in the intestines. And by definition, obviously, there'll be some degree of inflammation in the appendix, but that is not what we call acute appendicitis. And acute appendicitis is something that requires antibiotics and in most cases surgery to be dealt with. So appendicitis is suspected. That is a different issue, but if there is scans done and the blood test done and it confirms appendicitis, then I think in most cases that would have required surgery. So no, I don't think appendicitis and COVID are going to complicate each other. But of course, it does become a challenge to do surgery when somebody has COVID infection.
COVID, yeah. True, sir. Thank you. Sir, there is one more question. Mr. Tapan is asking, I think Ruba can answer better for this. Mr. Tapan and his wife both are diabetic and recently recovered from COVID. And he's asking what fruits they can eat. What is recommended? Ms. Ruba.
Regarding the fruits or the carbohydrates containing food, for diabetic patients, we tend to advise them to follow or consume more of the low glycemic index food rather than the high glycemic index. What does it mean? It means that how quickly the food containing carbohydrates affect your blood sugar level when eating by themselves. So it is classified into low glycemic index, 55 or below score, and moderate, which is between 56 to 69. And then if it is high, it will be more than 70. The fruits that are usually low in glycemic index, cherries, kiwis, grapefruits, any kind of berries, actually, pears as well, and then apples. And rather than consuming high glycemic index food like bananas, mango, dried fruits.
Yeah, thank you. There is one more question from Mr. Savara Dhar. Is pancreatitis or increased pancreatic and liver enzymes a common side effect of COVID-19? Doc, I think you can answer this better.
Yes, certainly in patients who are hospitalized because of COVID, when we do the blood tests, we see liver enzymes being elevated, sometimes quite a lot, pancreatic enzymes elevated. But as I said in my talk, this is part of a general inflammation. This does not mean that there is going to be long-term damage to the pancreas or the liver, and the enzymes will settle down in a few days or a few weeks for most people. And only if the problem is persistent, say 5 weeks, 6 weeks, 8 weeks after the infection, that we would actually do more tests to find out if there's a separate problem with the liver or the pancreas. Finding these liver enzymes or pancreatic enzymes going up in the acute infection with COVID or any other viral illness is not a cause of worry. Okay, we would monitor it, And if it gets back to normal, we would leave it at that. We would not keep digging into it. But if it persists, say, into month 2, month 3, then yes, we would do further tests to find out if there's a separate problem.
Yeah, thank you, sir. There is one more question, interesting question. Ms. VG Kannan is asking, she was suffering from COVID and she has recovered. Now it is 45, 50 days. And now she's consuming 2.5 to 3 liters of fluid every day. But still she feels dehydrated. Her sugar level is normal, but her question is why this polydipsia is still there. I think both Dr. Navid and Rupa both can give their aspects.
Look, I would need to know if there's any other health issues. I mean, first of all, let me congratulate you for having recovered from this problem, but I would also like to know whether there's any other health issues. You know, for example, if there is high blood sugars, okay, then you will need to drink more fluids. Okay?
Yeah, she's writing her glucose level is normal.
Yeah. So the thirst aspect is related to not just the food. It's not just related, but it's also related to salt levels. You know, about whether there's high sugars in the body, and it's also related to what your mind is saying. You know, and how efficient the kidney system is working and how the feedback goes to the brain. So it's a little bit more complicated. It's a neurochemical, neurohormonal system. Thirst is a complicated issue. But to put it in simple words for everybody to understand, look, a human body needs about 2 liters to 2.5 liters of fluids every day. If you drink that much of fluid, and if you're having a decent amount of urine, normal colored urine without any, you know, high colored, and you're comfortable, that's fine. If you're feeling thirsty in spite of taking 2.5 liters of fluids, then I would visit a physician and do some simple tests on the blood and perhaps on the urine also to see if there's any loss of any electrolytes or any electrolyte disturbances, salt disturbances. You know, sometimes hormonal disturbances can also cause this. There's a condition called diabetes insipidus, which is not, which is very diabetes mellitus, which is sugar related. If it's short period, you know, for 1 or 2 weeks, I wouldn't worry. But if it's beyond that, then I would see a physician and get some basic tests done to see that whether there's a medical condition or is it just something that will pass.
Yeah. Ms. Rupa, you can also add something. Yeah, sure.
From nutrition aspect, she should be like also monitoring her salt intake or spicy food, also like the type of food. Maybe she's consuming so much of salty food like pickles or spicy food, some nuts even. Some of the foods that are actually depriving the water from the body, like if she's having a fattening food, also she will feel thirsty. Also with any other problem, she should be, as doctor mentioned, she should be testing if she has any hormonal issues, blood sugar. Again, she needs to know the reason behind that. And then drinking a lot of water or fluids in general to the maximum level, it can be harmful as well. So she can stick to the amount that her body needs, and then include fluids in another way. It could be just through the food as it is, like salads, fruits. Let her focus more on the food that are rich in fluids and give her the feeling of satiety and enhance this problem with her.
Yeah. Ms. Hasina is asking, because I think she's worried about the kids. What do we offer the kids who had COVID? What to eat? Because, you know, kids are very reluctant to eat anything. So what should we offer them to eat?
Regardless to the child's age, if there is any loss of appetite, of course, we need to monitor the weight loss. if they are losing weight or no. This is very important. We try not to let them lose continuously. Keep offering them different options. This can be helpful, different from the food that they are used to. Because during the illness, even if it's not COVID itself, when the pediatric or the child is having any fever or any stomach pain or just nausea, he will not feel like eating. So we offer more of the fluids to make sure that he's not dehydrated, first of all. And we can offer other easy to eat or easy to drink foods and drinks like smoothies that are actually high in calorie and nutrient dense, rich in protein, that will support them from losing the muscles or weight in general. And we can keep offering them adding let's say some flavors, natural flavors, rather than spices. Like they can add also some kind of natural, let's say honey, enhancing the flavor of salads, like fruit salads. Make the food colorful as much as possible to make sure that they are getting different nutrients. If the child is not willing, also every half an hour or 1 hour, even small bites, it will help. So this is very important.
Yeah, thank you. One more question from Mr. Sahed Singh. He's asking, are hyperacidity and gastric reflux same? Doc, I think you can answer better.
Okay. Right. So let me explain it in as simple way as I can. Okay. Our stomach produces acid. Okay. The stomach has cells dedicated to producing acid. So this is important for digestion to be kick-started. So all of us, you, me, everybody will have acid in the stomach when we eat food, and sometimes when we don't eat food also. The stomach also produces some mucus, and it forms a thin layer to protect the lining of the stomach. So that is why our stomach doesn't get damaged by acid. Okay, there is a protective layer predominantly made up of mucus that protects the stomach. So when there is normal acid levels and the stomach is healthy, you eat healthy food, there is no problem. When there is too much spicy food, when there is a stomach infection, when there is excess acid production, then the mucus barrier is slightly damaged, and then that causes inflammation. It can cause ulcers also. So this is basically acid-related damage to the stomach. Now, acid reflux is different. Acid reflux is when the acid from the stomach comes up into the chest. This is reflux. Normally, there is a mechanism that prevents this from happening. There's a sphincter, there's a muscle at the lower end of the esophagus, which keeps the junction closed. So it only opens up when we eat and drink, and it should normally stay closed. For any reason, if it is open more frequently. And one of the common reasons is more pressure in the stomach. So for example, if somebody is overweight and obese, or somebody eats too much, or during pregnancy, or if there is any reason for stomach to be bigger, or you're wearing tight clothes, for example, wearing unusually tight clothes, or having a lot of chronic constipation, or having a lot of coughing. Anything that increases the pressure in the stomach will push acid up. This coming up of the acid into the chest is called acid reflux. So this is common, particularly if people have these predisposing conditions. But acidity is normal. When you talk about hyperacidity, that is excessive acid, that is actually not so common. What happens is most people have normal levels of acid, and because of choices that we make, the protection in the stomach is temporarily or long-term, it's damaged, and that causes symptoms. And for other reasons, there is acid reflux. So they are connected, but they are slightly different. I don't know if I explained that clearly, but
no, it was perfect, sir. It was perfect. Thank you, sir. There is one more question from two more questions are there. One is Harsha Vardhani. She's asking whether frequent urination is related to COVID or any digestive issues.
Frequent urination is not directly connected to any digestive issues as such. Okay, so frequent urination suggests that there is a disturbance in fluid and salt levels in the body again, or that there is a problem with the urinary bladder itself. Okay, so there is the kidneys produce the urine, and the urine is stored in the bladder, and the bladder has a certain capacity. And when it gets full or nearly full, you get the urge to go and pass urine. But if it is happening frequently, then it could be because we are drinking too much fluid. I mean, more than 3-4 liters of fluid. If you drink, you will have to go and pass urine more frequently. Or if you're drinking too much fluid, say some people have the habit of drinking half a liter or 1 liter of fluid in the morning. Of course, your body doesn't need that much of fluid that early in the morning. You will pass more urine. Or if there's any disturbance in salt levels, or as we discussed before, any hormonal levels, you might go more frequently. Or it could be a bladder problem itself. Your bladder is not able to hold urine, so you might be going more frequently. But the commonest reason for frequent urination, or along with or without burning, is a simple urinary infection. So there are many reasons why you could be passing, but I don't think COVID per se causes frequent urination, and certainly not because of any digestive problem.
Thank you, sir. There is one last question. I think you should be answering this also. Does COVID-19 affect the secretion of digestive glands like pancreas or gallbladder? And connected question, if the person is having gallbladder and he has to go for a surgery, is surgery to be done, or it has to be avoided for
So there's two questions here. Does COVID-19 affect the digestive glands like the pancreas and gallbladder? As I said before, yes, it can cause a bit of inflammation in the pancreas when the enzymes go up, but usually this is mild. We have not seen a lot of severe pancreatitis because of COVID. But if somebody has had pancreatitis problems before and they have an issue with pancreatitis in the past, then they probably are going to be at risk of pancreatitis in any illness. You know, when there's dehydration, when there is an inflammation, then the pancreatitis can be a problem. But as I said before, most of the time it is just an elevation in the enzymes, and it recovers on its own as the person recovers from COVID. Okay, so yes, it can affect it, but mild and temporary is the norm, and it is usually not severe. Gallstones is an interesting thing. Now, if there is just a gallstone and it is not causing any problems in the gallbladder, then I would not talk about surgery in the immediate setting.
Yeah.
There is a blockage to the outflow of bile from the gallbladder, or if there's an infection in the gallbladder, then we have to take it on a case-by-case basis. If it's a mild problem or a moderate problem, I would probably give antibiotics, wait for the COVID illness to pass, and then talk about surgery month, 2 months, 3 months later. That is quite acceptable, that's possible. If the infection is severe, if there's a blockage, if the person is actually jaundiced, then I don't think we have the luxury of delaying things. I think we have to start antibiotics, and we have to talk about surgery in this context. You know, if the COVID illness is mild, then yes, we can take that risk and do. It becomes more and more challenging if the COVID illness is also severe and the gallbladder problem also is severe. But hopefully that has not been the case, and hopefully that is not thankfully that's not a common problem. But surgery will be required if there's an ongoing infection and if there's a blockage. That's crucial.
Yeah. Thank you, sir. Sir, I think all the questions have been answered very fluently. And Professor, sir, there is no more questions, so you can take over.
From my side, a quick question to Ruba. Ruba, I have 2 beautiful grandchildren, and my daughter is having a difficult time getting my children to eat the right things. All they like is chips and ice cream. So how can you help me as a grandfather to see that my 2 beautiful grandchildren eat the right things. Is there anything that you can do to help me to encourage my grandchildren to eat the right things?
Actually, Doc, this is the one most common thing, problem among many children. And they usually, when they see other children, they will start, imitating them and trying to eat the same way they are doing. And we are, as adults also, we like such things. So the children, they tend to do or eat whatever their parents are eating as well. So the first thing is to minimizing or providing less of these things to the children, especially in the house. Let them understand that this is something like not very often, maybe once in a while. Maybe when they go out, they can have few, not all. And then they should be changing the setting of the food, like where they are eating. Let them have a routine. Every day, try to let them eat at the same time. This is very important. It will encourage them and teach them that the priority is now for food. Gathering around the table all together, not leaving them to eat alone or separately from the parents. So I was just saying that to keep, they should be keep offering the children different choices as well. And from when they wake up, do not force them as well to eat, because if you force the children to eat certain food, they will tend to get irritated and refuse even more. So once they do, try to offer them other options and always include them in preparation. This will help the children as well and encourage them. So let them help, like ask them, what do you prefer today? The preferences will be according also to the mother's choice, but then let them choose, like whether they want to eat between the two different kind of vegetables available. Encourage them also, try to engage them in nutrition activities. Let them watch some of the things that, like even songs, small things that talks about the benefits of the food. And then changing the way it is prepared, it may affect that as well. Like the children, if they are used to eat it in certain way, like as a soup or a cut vegetable, change it, make it as a cake, like fish cake, for example, any kind of encouraging or colorful food that the children might be interested in eating as well.
Thank you. Thank you. Thank you so much, Ruba. Thank you so much. Thank you so much. You know, there are some sessions that we wish can carry on forever. And this was one of those sessions.
True.
I never thought it was possible for any COVID plus session to be better than the neuropsychology session. But I must tell you that, well, I'm absolutely delighted with this session. Not only have we overshot our time, which I apologize for, but I am so grateful to our two speakers that gave us such valuable information, Dr. Naveed and Ruba. Thank you, thank you, thank you ever so much. Friends, I would also like to thank our tech support. That would be the team behind this, the Arabian Wellness team. I would like to thank Dr. Wilku and Shrikant and Sadeh. Thank you ever so much for your support. I would like to thank all the participants. Now, while Dr. Wilku might actually have said, we've answered all the questions, I know for a fact that there are several questions that we couldn't get to for want of time. So I'm going to request all those whose questions were not answered to kindly log in to our website. This is the this is the COVID Rehab website that is hosted by the RAC Hospital with support from ARISE and the UNDRR. I'm going to ask all of you, kindly log in, and our specialists will answer your questions as far as digestive ailments are concerned. Dr. Naveed and Ruba will answer those questions. Our website contains a lot more than COVID Rehab. Well, COVID Rehab is the main objective, but we have several videos. We have the recording of every seminar that we conduct. We upload it thereafter. That's 1 hour of vitally good information. We have the videos, we have information, all of it. Please log in and we will be happy to answer your questions. Friends, on my behalf and on behalf of the RAC hospitals and ARISE, thank you so much to our speakers and our audience for this session. Thank you so much and good day.